Hi everyone, I'm Kaveri. I'm a third year medical student from DGS Global Institute of Medical Sciences, Bangalore. It was a hard year for all of us. Some of the second year students have given their exams, some haven't. All those who have had their exams feel that it was extremely difficult because they did not have classes, no clinicals, and most of us would play classes only for the sake of attendance. All those who have not given exams are even more frustrated. And in this video, I would like to talk about a few things to follow and keep in mind just to not flunk in exams. We all have started reading all the foreign authored complex books in the beginning. After a couple of months, we realized that it was waste of time. Or for some people, maybe it is not because they keep on revising and so they remember all the concepts. Let's take an instance. We read a foreign authored book, we take a lot of time to understand a concept, and the next second when a friend asks us to explain it, we're just like, okay, I've read it, but I don't remember. Maybe after I revise, I'll tell you. But on the other hand, so many students read simple Indian books and they remember concepts for a longer time. They take very small amount of time to finish it, they remember it, and it is very easy to understand. So one thing that I have realized is, whatever the book that you read throughout the year, how you revise using these simple books in the last 1 month before exams is what matters. When you revise from these simple books, you know exactly how much to write for each question. For example, let's take the topic of rheumatic heart disease and pathology. If you have read from Robbins or Hashmohan, you have this much information. For a 10 marker or 5 marker, you don't know how much of it to put on the paper. So you will end up wasting a lot of time in the exam. Instead, if you have read it from some small book like Ramdas Nayak, you know how much to write in the paper. So you save a lot of time and you can effectively answer so many questions in the exam. In the same way, let's take pharmacology. You read KDT, you understand it, but you don't remember it. On the other hand, people who read Shanbagh understand it, they have a lot of time to revise it again and again, and they do much well compared to the people who have read complex books in the exams. Now let's take instance of each subject. In pathology, you do not have to know all the H&E diagrams to draw in the exam. Now, you hardly get, H&E diagrams for about like 5 or 10 marks at the max. So even though you don't know H&E diagrams, you can write the paper extremely well. So if you are someone who finds it very hard to learn H&E diagrams, don't learn. For boards especially, don't learn. You read Ramdas Nayak, you will get the simplified version of answers to write in the exam, and that's it. And if you get a question for which you know very little input, just write it in the form of flowchart and explain it again. That will do all the work. In pharma, I know remembering drugs is extremely hard. So if you're thinking only for boards, if you know like 2 drugs for each class, then that is more than enough. If you can't remember even that, at least 1. Or okay, you can't remember even that, it's fine. It's okay. Because you will get classification for hardly like 5-6 marks, and if you don't write it, it's extremely okay. So don't stress anywhere. Now when you read books like Shanbagh, mechanism of action of each drug becomes so simple and you can easily write it in the exam. And the side effects, yeah, and everyone knows headache and vomiting and GSI, disturbances to writing side effects. And I think it is common for most of the drugs, and you will obviously get marks by writing it. I know micro is hard for a lot of people, and I personally feel micro difficult. And I ended up not revising parasitology before exams because it is hard and you don't have enough time. I suggest you make your own notes for like bacteriology, virology, parasitology if you can. And in bacteriology, what I have seen is, you get questions about lab diagnosis. In bacteriology, virology, mycology also, most of the questions have lab diagnosis in them. So you need to know the lab diagnosis, and remembering everything is hard. So you should always make a rough diagram or a rough image of what you're writing. Like if it's a bacteriology question, you need to write about whether it is a gram-positive or gram-negative gram-negative organism. So beforehand, you need to have a sheet or something where you have written everything separately. So once you know it is a gram-positive organism, you can easily draw a diagram and that will fetch you an extra mark. And differential diagnosis is a must. So you can write the organism and the differential diagnosis and the special investigation to identify it in the paper beforehand and revise only that much. And things like ELISA and PCR are common for all the organisms, and you can just write 1 or 2 points and it will fetch a lot of marks. In virology, you can make a tabular column of all the DNA and RNA viruses along with your symmetry, and you can just revise it so that whatever the question, you can write something about it in the answer booklet. And general and immunology is easy. Immunology, because you have it in patho, and it is very common. I think you can write something about it in the exam. You can put diagrams here and there where it is necessary, because it will obviously fetch a lot of marks. And now coming to forensic, we all have like 2 days of gap for forensic, and because we have 2 days of gap, we do not revise it properly. And from Narayan Reddy, I know it is very hard to read before exam, so I think Singhi is the best for forensic. When you read Singhi, you know exactly what to write. There are flow charts, there are line diagrams, and you remember it better. Yeah, and some of the 10 markers are very big, but when you read a 10 marker from Singhi, you will be covering up all the 5 markers. So you'll be saving up a lot of time. And don't ever neglect toxicology, because we had questions for like 30 to 40 marks from toxicology, and I think toxicology is not that hard. You have very little chapters, and if you have done it, it is like saving a lot of time. And I would like to tell about one more thing. Now, a lot of people start with the portions which have more weightage. Like in micro, they start with bacteriology and neglect mycology. But what I feel is, see now, things like bacteriology and virology will take a lot of time to revise. Virology might take like 8 to 9 hours, but on the other hand, mycology will take just 45 minutes. So if you do mycology first, you're sure about the topic, because the topic is very easy and you're sure of getting that 10 marks. So I think covering those easier ones with less weightage, holds very important at the end, because you know the answer and it is easy and you can save a lot of time in your exams, and those are all like sure shot and easy to answer questions. And so many of us would have put in a lot of effort, and sometimes something bad goes and we flunk, and sometimes some people have not put a lot of effort, they get very good marks, and we always, it just happens, okay? So if you have put in all your efforts and something has gone wrong, please don't take it the negative way. You try to put in all your efforts in the next coming exams, and you can do it. See, once you have learned how to get through it and clear that exam, it will be an example throughout your life. So whenever you have failures, it will be you will have that thing in you that, okay, once this thing had happened and I came across, right, just conquered it, and it will just help you keep going. So I think what is more important is you not giving up and trying to clear those exams or clear any difficulties in your life is more important. Do not panic before exams. Even though if you have finished just like 50% of your syllabus or revision before exams, it is completely okay. Do the frequently asked RS questions of the other chapters, and it will do good. You can answer like 70% of the paper, and the remaining 30%, if you don't know, write something which is related to it. You will get like 1 or 1.5 mark for that question, and at the end it will all add up. So don't panic at all. And 10 markers will always have 2 to 3 parts. So you know 2 to lines about each part, it is going to fetch you 3 to 4 marks. Everything is going to add up, right? Something. Even though you don't know anything, something related to it will fetch 1 mark, and some questions you'll know something more. So at the end, you will get passing marks. Don't worry about it at all. Just try to draw more diagrams, flow charts, and explain about it. So you will fill page and try to write neatly, and that is more important. Once your the answer booklet looks very neat, people will think that you know something, and it's going to add up like anything. And for boards, I think you can always follow this. I mean, obviously for NEET or next, you can't do this because you need to know subjects in depth. But in the last month of before exams, I think this strategy will help best. Discuss drug names or some very important concepts with your friends. You will always remember it in the exam, like drug names. If you discuss a classification with your friends, even though if you have not revised it before exam, it will just flash in the exam hall because you have discussed, you have that voice in your memory. So don't worry, take care, all the best, thank you.